My name is Shelley Summer, and on behalf of myself and Dr. Robin Shook, the Director of Weighing In, I want to welcome you to our first quarterly meeting of 2021. We're glad to have you all with us today. We're really excited to be releasing our regional physical activity plan. So that's going to be the focus of our meeting today. You can see from our agenda, that's our main presentation, and it will be Dr. Shook who's sharing that with us. And then we're going to give you a little bit more information from each of the different sectors that have been working over the past year, just a little over a year now, working on strategies and tactics for the physical activity plan. So before we get started, I do want to do a few introductions. I hope most of you know our Weighing In team. Weighing In is a program at Children's Mercy Hospital that sits within the Center for Children's Healthy Lifestyles and Nutrition. The center is a joint center between Children's Mercy and the University of Kansas Medical Center. And Weighing In is a program working to promote healthy lifestyles through community collaboration. So again, we're really happy to release this physical activity plan, which has been a majority of our work over the past year. And I really want to recognize the people who've been actively involved with it. We have both sector leads for the Kansas City Physical Activity Plan. You'll hear from a number of those, but I want to recognize right now the Weighing In team. We are small but mighty. I want to recognize Matt Kleinman. He is our technology support and has done quite a bit in terms of website updates, design for our documents. He's the newest member of our team, and we're really pleased to have him as part of it. I want to recognize Emily Meisten Sebelius. She is helping with the evaluation today. She has been a member of the team for a little over 6 years, and we're really pleased to have her with us. Elizabeth Wilson, who is the one who sends out our monthly communications. We'll talk a little bit more about that toward the end of the meeting. If you're not already on our distribution list, we'd love for you to join us. I want to recognize Bryce Miller, who is a graduate research assistant with us. He is just all around support, pretty much a jack of all trades. If you need something that somebody else isn't already managing, Bryce steps up and helps out. And then I also want to recognize our health science intern who's with us this semester, and that's Elizabeth Bodeker. So thanks again to our Weighing In team. I hope you're all familiar with them, and if you're not, you should be. A few housekeeping items. As we get started this morning, we'd love for you to include your name on your screen so we can tell who all is with us. I'd like to ask that everyone mute yourselves during the presentation so we avoid echoes and background noise. There will be an opportunity for questions, and we'll ask you to unmute yourself to ask those questions, but just during the presentation periods, if you don't mind doing that, that would be appreciated. As you go through, you may want to consider changing your view to a presenter view so you can see the person speaking along with the slides. I do also want to let you know we will have the presentation available both as slides and as a recording. And as I say that, I want to make sure you all know we are recording this presentation if that impacts how you want to show yourself on the screen, etc. So with that, I would like to invite Dr. Shook to share updates on the regional physical activity plan. Dr. Shook.
Hi there. Good morning, everybody. I was just telling the group before we started that, we're a year into this pandemic, and there's a lot of things that have changed, and there's a lot of things that we miss. And one of the things that I miss, and I think about it every 3 months when we do our quarterly meetings, is I miss the Kaufman breakfast buffet with oatmeal and fruit and coffee. So I'm looking forward to the day when we can all meet in person again and gather in person again for these meetings. And I think it's going to be sooner rather than later. So I'm optimistic for that. So let's see, I'm going to share my screen. Just a second, get this in order. Okay, so as Shelley mentioned, the topic of today's quarterly meeting is the Kansas City Physical Activity Plan. You've heard us talk a lot about the Kansas City Physical Activity Plan over the past year and a half or so, and it's been our main initiative that we've been working on, and we've done a lot of work over the past year and a half, and so we're going to share our progress, and we're excited that at this point, we have actually completed the development of the first ever Kansas City Physical Activity Plan. So I'm going to try to keep this to about 10 minutes today, just give you a broad overview of what the Kansas City Physical Activity Plan is, and really specifically the format that we're sharing or that we're using to share the information in the physical activity plan. But the bulk of the conversation today is really going to focus on the work that has been done in each of the sectors, because that's really where all the action is. So with that, we started the Kansas City Physical Activity Plan development process in October 2019 with our core work group members. And it continued in earnest. Well, it continues today, but our planning for the actual strategies and priorities of the Kansas City Physical Activity Plan culminated at the end of 2020. During that period of time, from October 2019 to December 2020, we held 55 total meetings related to the physical activity plan, including our large event in September 2020, the Kansas City Physical Activity Summit. During that, across all 55 of those meetings, we had 550 people participate at some level in the process. We did lots and lots of things to gather input and solicit feedback from all of these participants, including surveys where we asked people to rank things and prioritize different items. But really, that was the only thing that was universal across all the sectors. Each sector really kind of took their own approach to how they developed the plan. And we may discuss that a little bit today when we go around the sectors, but if not, it's going to be fully documented in the actual plan. The plan, which we'll talk about, is very thorough. At this moment in time, it's close to 80 pages. So it's very, very thorough, and we describe every step along the way. However, we know that that's more information than most of you are going to need. And so we released something called a Playbook in December 2020. I'll briefly talk about what that Playbook is, but in short, it is a more easily readable and shareable document that has all the same important information around the plan in it. We've already had several successes. The first one was in November, where we, as the Kansas City Physical Activity Plan, could collectively support the Complete Streets Ordinance that was in front of Wyandotte County Council. And we are happy we were able to testify and submit letters of support on behalf of the Physical Activity Plan. And we are very excited that it was unanimously adopted towards the end of 2020. We've also received 3 grants already to support implementation projects. And that's really just the start of the implementation that we're going to do for the plan itself. And I'll talk a little bit about that later. The full plan will be released on Monday, March 22nd. The plan is developed right now. We're fine-tuning some of the language around it and the graphics and things like that. And we will make that publicly available on March 22nd. And we'll do that in a couple different ways. If you're, most of you are already signed up for the Weighing In newsletter, so you'll receive it in your inbox that morning. It'll also appear on our website that day as well. We also have several other launch activities planned, but those are the 2 main ways that you can find the plan. So just as a reminder, I think I've shared this slide a couple of times, but the goal of the Kansas City Physical Activity Plan is to create a Kansas City focused, sector specific strategy and tactics that if adopted would foster a culture of physical activity within our region. And we think that this is important for several reasons. One is we are making a collective statement that physical activity is a public health priority in Kansas City. We also are establishing a multi-sector coalition to advocate for priorities. We all know that we can't work in our silos. We have to work with a collective voice to change important and systemic things such as access to physical activity. And we're also creating a framework for implementation of strategies and tactics. This plan is not a document that is just going to sit on a shelf. We want to have a ready to go toolkit and roadmap for anyone to pick up and use to implement the strategies and tactics. We have 3 overarching priorities for the Kansas City Physical Activity Plan. And these are in addition to the sector specific strategies that we're going to talk about in just a minute. But the overarching priorities are we are going to advocate for local funding, increased local funding for physical activity initiatives throughout our region. We are advocating for regular, comprehensive surveillance of relevant physical activity metrics, and alongside that, regular regional reporting of those metrics. We have released the first version of this in September 2020 called the Kansas City Regional Physical Activity Report Card. We have 4 guiding principles for the physical activity plan. And so these were considered as the sectors were meeting and developing their strategies and priorities. The first is that we want to ensure equitable access to safe places for physical activity. Everything we do, we want it to be evidence-based and community-informed. And finally, it has to be systems-wide policy and environmental change. We certain projects may be very narrowly focused around a specific topic, but it must fit within a larger plan to address the system in which we all live in, and that ultimately dictates our levels of physical activity. Oops. So here is who has really kind of led this work. So Weighing In has served as the backbone organization for the Kansas City Physical Activity Plan. So Shelley introduced all of the members of Weighing In, and our role in the project were to provide administrative support for all the sectors. We help manage communications, facilitate meetings, we compile all the recommendations. We put this all together into a nice, easy to read format and a document that we can share with everyone. The bulk of the work was done by our core work group. And so there are 13 members of our core work group, and they represent either leaders of one of the societal sectors or ad hoc members who provide specific expertise in a content area that we wanted them to be a part of the core work group. And so this group provides strategic decision-making for the development of the plan. They led the sector work groups, and they recruited lots of other organizations and partners to join in the development of the plan. So we're going to meet, and you're going to hear from several of these core work group members throughout the rest of the presentation today. But a big hats off to them for all their work that they committed over the last year. And then there were the sector-specific work groups. And so here are the sector-specific work groups. They are organized around societal sector where we spend our lives. So infrastructure, early childhood, healthcare, faith-based settings, healthy schools, and parks and recreation were the 6 sectors that we launched in 2020. In 2021, we're launching the final 4 additional sectors, and that's sport, business, media, and public health. And like I said, you'll hear from these sectors, the 6 sectors that we've already formed later in today's presentation. So we have created 3 documents over the course of the year. 2 of them have already been released and 1 will be released in a couple weeks. The first is getting to the overarching priority of reporting of physical activity metrics in our region. And so that took the form of the 2020 Kansas City Regional Report Card on Physical Activity for Children and Youth. So that was released in September, and it assigned letter grades for overall physical activity and 9 or 10 key physical activity indicators that ultimately determine overall physical activity. So this was used, this report was generated using only local data, so it is very Kansas City specific. You can find this report on our website, kcphysicalactivityplan.org. The second document was the Kansas City Physical Activity Playbook. So we released that at the end of 2020, and this is the summary document for the physical activity plan. So as I mentioned, the full physical activity plan is very, very detailed. The playbook is a companion piece that is much more easier to read, and it features this card style format. And I'm going to show you what some of those cards look like in just a minute. But for most people, they're probably going to want to use the playbook as a way to utilize the physical activity plan. The Kansas City Physical Activity Plan is going to be a much more deeper dive into the physical activity plan, both in the creation, the process that we used to develop the plan, all the meetings that we had, and very detailed recommendations for strategies, priorities, and approaches. So we're using a lot of different terms here. And so I just want to clarify what we mean when we're talking about these specific things. So the first 2 are strategies and priorities. So strategies are broad, evidence-based approaches to promote physical activity. Now, these are organized by societal sector, and I've got an example of all of these things in the next couple slides. Below that, we have priorities, and these are tactics that, if accomplished, would support the sector-specific strategies that they sit under. And so here are the 22 strategies that were developed for the 6 sectors in 2020. And so you can see them all listed right here, and I'm not going to go through them all, but the sectors, we'll talk about them later on in the presentation. It works out to 3 or 4 strategies were developed per sector. Faith-based setting had 5 because they're overachievers. You'll note that each of the sectors are organized by color, just to make it easier to find and easier to distinguish between each of the sectors. Now, the final 3 terms that we use and that you'll find in the document are approach, local leaders, and community approaches. And so I'll show you an example of this on the next slide, but approach is current activities that decision makers can implement now. And in the document, you'll see there's a little arrow icon that sits next to these approaches so you can identify them. Local leaders refers to things that organizations or partners that are already active in this particular sector can do to implement the strategies and priorities. And the icon we used for this is the 3 individuals that are standing with one of them has their hand up with a flag in the air. And then the final is community approaches. And these refer to things that residents and partners that may not currently be actively involved in the sector can do to get involved. And that is represented by the icon of the group of people that you can see right there. So let's use the Healthy Schools as an example. So this is from the Kansas City Physical Activity Plan document. And this is what but it is representative. This is just for Healthy Schools, but this is representative of what all the sectors look like in the plan. So the first page always provides an overview of the sector and lists the strategies that they've identified. So for example, in the sector overview, they talk a little bit about the sector itself. So school is the central focus of daily life for most children, and about half of the child's physical activity occurs in the school. So that's an overview of the sector and why it's important. There's the 3 strategies that were developed by the Healthy Schools sector. Then on the next 2 pages, describe or is information on how the strategies and priorities were developed. So there's information on the process, the feedback they received. They had a particularly novel way of gathering input using youth voices. That was the community input. And then they also used the survey. So that's how they developed the items later in the document. And so here are the next 3 pages in the plan. And here's where we break things down by strategy. So here's the first strategy for the Healthy Schools group. There is the strategy itself, which again, here is the definition of what a strategy is: broad evidence-based approaches. Then it's followed by the priorities that fit under that strategy. So in this particular case, there were 3 priorities that directly support strategy 1. On the very next page are the approach, and here's that approach icon. It says approach right there. Here are things that are activities that decision makers can do if they're actively already involved, things that they can do immediately to support the strategies and priorities. The next page includes information on local leaders. So here's things that other organizations can do right now to support the strategies and priorities. And then right next to that is the community approaches. So here are ways for residents and other partners to get involved if they're not already doing that. So you will see the same format occur for each of the sectors within the Kansas City Physical Activity Plan. Okay? I hope that that makes sense, and we outline all of that in the plan itself. And so as you can see, this is when we have 22 strategies, you can see how this creates a very large document. But we think that's important to include all of that, to make all that information available to everybody. Okay, so here are the next steps. As I mentioned before, the Kansas City Physical Activity Plan will be released on Monday, March 22nd. It will pop into your email inbox if you're on our weighing in listserv, and it'll also be on our website. And the website, which is kcphysicalactivityplan.org, is the best way to connect with us and to learn more about the plan. We've got lots of great resources there. Of course, all of these documents, we will also have video tutorials. This video will be posted on there. And we've got lots of other ways to help you connect with our work. We have new sectors beginning later this year. So that's in sport, media, business, and public health. If you want to participate in those sectors, you can do so by signing up either on our website. You can reach out directly to us, either weighing in the general weighing in email account or one of the weighing in staff if you have a good connection with them. You can also sign up for a sector on our website as well. Here's our email, the general weighing in email, if you want to use that to connect with us. most importantly, I think, is we are actively implementing the strategies now. And so we have done the work already, as I mentioned, through 3 grants that we've received. These implementation projects are going to keep going. We're going to add new ones all the time. If you want to take on implementation of a strategy or priority, please do so. You can contact us and we can help you do that. If you just want to do it on your own, that's okay as well. Just let us know what you're planning to do. We want everyone to begin working on and implementing the strategies of the physical activity plan. And to that point, the Kansas City Physical Activity Plan is a living document. What we post on March 22nd is not going to be the final document. We have scheduled revisions to the plan built in, but we will make any changes as they are needed, as new people begin to be involved, as we start implementing projects and we learn new things. So please contribute and connect with us at any time. Okay, with that, I'm going to hand it off and we can start talking about the actual work that was done at the sector. So Shelley, what's, I guess, do I hand it back to you for this?
Sure.
Okay.
Thanks, Robin. I'm going to take just a couple of minutes to show you our website, and this is not going to go through it in detail, but I did want you to see what it looks like and how easy it is to get to. So, Matt, if you would do me the favor of clicking on, that should be a link in that document or in the presentation. Again, I want to recognize Matt for his work on creating the website. If we can't get to it, that's okay too. But this is where we're housing all of this information to make it easier for anyone who's interested in participating to get more information and get up-to-date information about the work that's going on. So you will find, as Robin already said, the playbook on this website. You'll find a little bit about our history. You'll find some videos that are a quick, easy way to get some updated information on what's actively going on. You can see Matt is going over the resources that we have, a click link to the playbook. You can also see the sector work groups tab at the top. That's where you can click on and join sector work groups. You're welcome to join one. You're welcome to join all. That tab right there will give you information about what's going on, recognize the leads in each of those different sectors, and we're going to hear a little bit about what's going on in those sectors today. But in terms of getting information and updates in the future, this is going to be where you're going to go. You can now see where you would join a sector. Very easy to do. Again, join one, join all. If you're more interested in the ones that are coming up, they're all listed in that section. So just wanted to take a minute to give you an idea of what that looked like. And thanks again to Matt for his outstanding design skills in putting all of that together. With that, what we'd like to do next is give some sector updates. The sectors that we're going to update right now really are the ones who've been hard at work over the last year. And we want to recognize those that have been heavily involved in this and have a few of the sector leads with us this morning to give these updates. So we're going to go ahead and get started with Healthy Schools. And I believe Michelle Dake is on with us this morning. Michelle, if you are, I'd love for you to unmute yourself and give the group a little bit of an update on what's going on in the Healthy Schools sector.
Yeah. Good morning, everyone. First, I just want to do a big thank you to Emily at weighing in, and also Robin Stewie with Midwest Dairy for their continued leadership on this project, because our very first meeting about the physical activity plan was February of 2020. And then our Healthy Schools group drastically changed 1 month later, but we've still been able to really get a lot of work done. So they should be very, very proud of their leadership. Here you can see our 3 strategies for Healthy Schools, but I want to first talk about just how we got here. So a little over a year ago, we started talking about this process, and we came to these 3 strategies in 2 ways. The first was taking a close look at the national plan and bringing that out to our whole Healthy Schools network. So that's a group of nonprofit professionals, community members, school leadership, and asking them to prioritize what makes sense to them in the national plan. And we kind of determined what rose to the top from that. At the same time, I'm so glad you got to see a little bit of the photos. We worked with elementary and middle school students from 20 different schools across the metro, and Emily and Matt did a really wonderful breakout session at our youth summit, asking students if they were in charge, if they were the principal for a day, how would they increase physical activity for all the students? And they did everything from discussions to they had budgets where they had physical dollars they were putting in buckets. We had two really kind of broad approaches. So a wide survey of partners and leaders and also youth voices. And from that, we were able to kind of land on these three big strategies. From as a group really went to those priorities of what in these three strategies, because they're very broad, makes sense for the Kansas City region, especially in 2020 and maybe in the next few years. So we had a very focused lens, a realistic lens on what will work for schools and families in an uncertain atmosphere. And so equity was kind of the forefront of our mind for a lot of reasons, not only just with the energy around social justice this past year, but also the reality check for schools and families that budgets and capacity are very, very different moving forward. So that's where our three strategies and the priorities within those strategies rose to the top. So our three strategies, the first is adopting the comprehensive school physical activity program model, which in itself is a very large, robust model that has a whole bunch of priorities and tactics within it. So what rose to the top for us within that model was prioritizing the adoption of the model across the region, providing professional development on the model for administrators and schools on just what is it, how to adopt it, what are the best practices, and then our focus from those best practices within the model around active transportation, quality physical education and assessment, and activity breaks throughout the day for students. The next strategy was providing more professional development for all educators on physical activity. So that's taking some of these best practices and priorities from the comprehensive school physical activity program and bringing it to the teacher level. So how do we provide professional development and support for all teachers, not just PE and wellness coordinators, to provide opportunities for physical activity during the school day? And then the last strategy here is advocating for policies that promote physical activity for all students. And the priorities here that really rose to the top came from the report card that Dr. Shook referenced earlier. So what was really wonderful with the timing of the report card, it was real-time identification of gaps in policies for our region that support physical activity. So priorities within this strategy are promoting PE as part of a well-rounded education, making sure it's part of that core curriculum, providing time for all elementary and middle school students to have recess, and then policies that also promote activity breaks throughout the school day. And that common theme of before and after school, active transportation, activity breaks meets our equity lens, because most of these activities are free and easy for not only families to participate in, but also very low cost for schools to participate. So that's where that big focus came from. And that was really nice to see that not only from our adults who participate in that large survey, but our youth identified physical activity breaks, more outdoor recess in particular, and more PE time as their big three priorities early back in March before we really dove into these strategies and priorities. Where we are now, so 1 year into the process as a larger group, we are currently working on some action items. So through this process, one opportunity that rose to the top was an opportunity to support the Kansas City Public Schools as they are going back in person. So a big need that was identified was more opportunities for physical activity because they have been virtual for so long. The district is hoping to offer sports camps on the weekends starting in April for elementary and middle school students and going through May. So there'll be a different theme every weekend. And coordinating with Carrie King, who is their PE coordinator as a part of our Healthy Schools group. The Healthy Schools group as a whole is hoping to provide coordinated supports for those efforts. So not only can students show up to learn to play flag football, but they can also then get involved with Girls on the Run. They can do a bike rodeo with Bike Walk KC. They can advocate for healthy and safe walking routes to those events. With the walking detective, we have physicians from the sports medicine department at Children's Mercy who are going to be offering just some training on warm-ups and best practices for body weight exercises. So it's going to be this full wraparound. Yes, you showed up for flag football, but here's all the things across Kansas City that you can participate in, and almost all of them are free. Next, we're hoping to have a regional promotion of Bike Month. That is in May. And a lot of our partners have in the past worked on Bike to School Day or Bike to School Week or just Bike Month as a whole. But we're really hoping to expand that audience to include everybody. So schools, families, parks and rec, how can we all get out and get on a bicycle this May and promote it together at a more coordinated effort? So we did something similar as a group for Walk to School Day back in October, and we expanded it to just Walktober and Walk to School Month, where it was, here are all the trails you can walk to, here are events around walking, here's how you can walk and stay safe and socially distanced. So it'll be a similar effort for this May of just a lot of community partners coming together to promote biking this May. I say last, our next step is this summer is reconnecting with our school leadership, so school administrators, school wellness coordinators. Now that a lot of schools are reopening and school schedules seem to be getting more regular, can we take a moment to listen again to our school partners and really spend some time of reaching out and going to them in particular and asking, where does their district or their building priorities line up with the physical activity plan and our priorities here, and how can we best work together? Because I think next school year will feel more normal, but it's still going to be, I think the needs are going to be different. So we want to make sure that we are all throughout the process listening as much as we can. And I think the capacity for our school partners to really participate and help us identify needs across the region is going to be more available. So we plan to spend a lot of time this summer listening and reconnecting to bring some new action steps to the forefront for 2021-2022 school year.
Thank you, Michelle. That was an excellent update. As you can hear, there's a lot of work that's gone into the development of these strategies and priorities, a lot of thoughtfulness, lots of conversation, engaging a variety of different groups. What I also like that you talked about is the cross-sector opportunities, and that's one of the values that we think this regional plan will bring. Because we all know, and as Robin mentioned at the beginning of the presentation, aligning our efforts is a key to moving forward and moving the needle in terms of increasing rates of physical activity and reducing chronic diseases. And what I love is that the ongoing conversations will continue. And so what we're going to do this morning is we're going to get updates from each of the sectors before we do Q&A, but we will have an opportunity for you all to ask questions as we go through here. So I'm going to make a call an audible here. We're instead of going to early childhood next, we're going to go to infrastructure next. I know Laura Steele is on the call. this morning, and I'd really love for her as the sector lead to give an update on this. And I know she has to leave us a little bit early this morning. So Laura, if you're on, we'd love for you to give an update on the infrastructure sector.
Thank you, Shelley. Thank you, everyone, for attending. My name is Laura Steele. I'm the Director of Education at Bike Walk KC. I had the wonderful chance to be a part of the core working group for the Kansas City Physical Activity Plan. It's been a wonderful experience. I also was one of the co-leads for the infrastructure sector work group. And I just want to mention really quickly that our infrastructure sector work group also covers transportation, land use, and community design. It seemed like a mouthful to add all of that, so we just tucked that all under the umbrella of infrastructure. Maggie Green was a co-lead, and we had support from Matt Kleinman from Children's Mercy, and they were fantastic. I learned a lot, had a lot of fun with this sector work group, but you can see here that we came up with 3 strategies and their following priorities. When we held our work groups, we were asked to convene other sector experts under those different areas of transportation, land use, and community design. And we did a series of Miro board. We used something called a Miro board. It's kind of like a digital sticky board. And we did a lot of asking of our group to look at the national priorities and tactics and help prioritize what would make sense in Kansas City. And so out of that, we ultimately came up with our 3 strategies. And again, like I said, the priorities follow. But what we really wanted to make sure that we did was follow that guidance from the National Physical Activity Plan, but make sure that whatever we were putting out was reflective of what was possible in Kansas City. So you can see here that we've got some strategies around collecting data, strategies around connecting different agencies to make sure that active transportation is an actual viable option for people. And then looking more about the engineering side of things and encouraging active design principles with land use, transportation, development, and community planning. So you can see from these, our priorities are kind of, these are where I kind of get excited, is kind of these little areas that tell us where we should go next. And I'm going to let you guys go ahead and read those. I'm sorry, I'm also watching my time. But the one thing that I want to mention coming out of the infrastructure sector work group was the emphasis on, cross-sector collaboration. Earlier, we were mentioning, that we can't do this work kind of just in our own little groups, but it really does take collaborating across the board to make sure that things happen. And so I'm just going to briefly mention here that one of the things that happened after the year's work of coming up with the strategies and priorities was the discussion of, how do we make sure that the work that we have put into this, that we kind of see the fruits of our labor. So in terms of, having accountability to the plan, holding others who were contributing to this, making sure that their efforts were held up, we formed a group called Physical Activity, Parks and Infrastructure. And so what this is coming together with Parks and Rec and the infrastructure sectors to hold meetings to talk about current projects that are happening around town that also relate back to some of these priorities that are here in the physical activity plan. I'm going to let Matt talk a little bit further about that, especially after the strategies and priorities from the Parks and Rec sector work group have been introduced. But that's something that, I see we are really going to be able to kind of have a greater impact as we work across these different sectors to make sure that what we've said is appropriate for Kansas City, that we've got a little bit of accountability towards that, And we can, again, like I said, see the fruits of our labor on it.
Thank you, Laura. We appreciate you joining us this morning, giving that update. You'll hear this constant theme throughout, and that's cross-sector work, aligning our efforts, because without that, we're going to have a hard time really getting people together to impact systems change. So the next group, I'm going to go ahead and go back to early childhood. I think Rhonda Erpelding is on the call this morning. Rhonda, I'll ask you to join us to give an update on early childhood.
Thank you, Shelley. Good morning, everybody. I'm Rhonda Erpelding, and I am a program manager at Harvesters, and I will be giving the early childhood working group overview for the physical activity plan. I first want to give a thank you to Emily from Children's Mercy, and also Lori Lanter from the UG for support, guidance, and just community connections to make this sector work group continue to develop. They have been really instrumental in help setting the foundation. So our early childhood sector group have identified 4 different strategies for the early childhood working group. At the beginning, it was really important that we took a good environmental sweep to look at all the efforts that have been made in the 6-county area around early childhood best practices around physical activity. We identified that there were many efforts that in the past, within the last 5 to 10 years, as well as current quality practices or initiatives, for instance, through the Family Conservancy or MARC or Child Care Aware of Kansas, was going on. And so after taking a look and doing that environmental scan, we also took a look at the National Physical Activity Plan, and we were able to identify the 4 strategies. Our strategies reflect areas around adopting standards, around professional development, around sharing and promoting best practices in physical activity in early childhood, and also opportunities and resources for families. Something that resonated very early on in our working group with various partners was just the importance that all children come with a family, and that there were a lot of great components that were already instilled in some of the early childhood community partners. For instance, maybe a policy council that parents were engaged with. Maybe it's a parent-teacher conference. Maybe it's different opportunities that families come in for engagement nights. And so that really resonated to the top, the importance that we wanted to make sure that we were integrating into systems that have already been developed in early childhood sector, but also identifying some new opportunities. And so you can see that we actually have family engagement as its own strategy. So the working group has already been working on some of the priorities that we've identified. One of the priority areas that we have already made some efforts toward is around professional development. Just last Saturday on March 6th, in collaboration with the Missouri Department of Health and Senior Services and the Move Smart Department, there was a 2-hour professional development workshop titled More Than Just Child's Play, Leading Joyful, Purposeful Physical Activities with Young Children, where 300 attendees participated in the 2-hour training. This is just one example how we've already started to leverage some of our community partners in activities that are already going on in the community to help move forward our strategies for the physical activity plan. Our next steps in our group is really to take a deeper dive and really partner with the early childhood community. In the 6-county area, we have identified some physical activity ambassadors, which we will be calling them. And those are representatives of the 6-county area that come from the early childhood community, whether that could be directors, teachers, it could be curriculum coordinators, it could be the cook. Finding that ambassador that can help to connect other early childhood professionals to first get the information out around the early childhood strategies and our physical activity plan, but also really utilizing their expertise and their knowledge and help to guide us what those next action steps can be and pilot some ideas that we have identified in our priorities. A next step for our working group too is to take a deeper dive into best practices and resources that have been identified for best practices both on a local and a national level. Early on, when we began the work for the physical activity plan, we did identify some tools that have already been established. And so our group will take a deeper dive into looking at those that we can move that strategy along as we continue to work with the early childhood sector. So we are also excited to partner with other sectors. For instance, when you think about the faith-based setting, many children attend, whether on Sunday or evening, where there are children there as well, and they may be doing some small group activities, whether that's through Sunday school or a children's program. And so I think there's definitely some opportunities down the road that we can integrate some of our strategies into other sectors, and other sectors we can integrate into our strategies. Shelley?
Thanks, Rhonda. That's outstanding. And I hope that many of you on the call were aware of the program that Rhonda was referring to that went on last week. That's information we were trying to communicate to the group as well. And I really love that aligning efforts. So again, we're not only do we want that to happen and do we talk about that, but with some of the work, you can actually see where aligning efforts is really helping. Okay, so the next sector is Parks and Rec. I'm going to invite Matt to come on and give a Park and Recreation update.
Sure, thank you, Shelley, and hello, everybody. Unfortunately, Roosevelt Lyons, the Deputy Director of Operations at the KCMO Parks and Rec, and Jen Jutt is the Superintendent of Parks and Community Services at the KCMO Parks and Rec, weren't able to make it today to share this update, but they have been the sector co-leads for the Parks and Recreation sector. And so it's really been great to work with them. They have pulled in a lot of great contacts and connections to join the sector work group meetings that were held in late 2020. And we had great representation from across the 6 counties that the KC Physical Activity Plan intends to kind of consider when we talk about Kansas City as an entire region. So I'll just briefly share a couple updates that talk about these strategies. And so the first one is developing new park programs that support physical activity opportunities for all residents. And there were a few priorities associated with that strategy that the KCPA plan sector work group for Parks and Rec focused on. The first one was just to really promote cross-sector partnerships. Parks and Rec folks definitely understand that folks from every sector, whether it's local businesses, local churches, schools that want to be connected, they have an interest in their local park amenities and resources, and finding better ways to build collaboration was a priority for that sector work group. Another conversation that came up was reimagining parks as a third choice amenity, meaning that when you want to be physically active, you can do so in your home, you can maybe do so at work, but in between those two locations, oftentimes you'll pass a park in your neighborhood or nearby. And so looking at ways to promote that as a viable alternative place to be physically active was a priority. And then also engaging with local environmental conservation organizations. There are many environmental justice organizations, groups that work on planting trees and restoring waterways and looking at air quality. The Parks and Rec sector saw that as an opportunity to build new relationships and also increase physical activity by getting people out and about in their parks. The strategy 12 was specific to working with community partners to better track the participation in community-based physical activity programs, so that it can better engage with all of the audiences that use the Parks and Rec spaces. That really came about partially because of the National Physical Activity Plan's priority on better tracking of who's doing what, so we can measure progress and improve that progress over time. The priority of the sector work group really looked at the ways that they could start to use more innovative tools with a focus on specific areas or community groups. And so one example of that came from the Johnson County Parks and Recreation District, who talked about how they were, in the age of COVID, using signage with, photos and QR codes that people could scan and kind of share a little bit of feedback on their park. And that was an innovative model for tracking participation, because now they can look back and see who is engaging in those spaces. So examples like that were of interest to other parks and recreation groups who were looking at ways to promote physical activity. The other one was to use data to better engage with the audiences that are engaged in parks and rec activities daily, especially through sharing the mission of park and rec departments and those types of organizations that work in park and rec spaces, but also to look at how storytelling can amplify some of the opportunities. A great example of that comes from groups like the KCMO Parks and Rec Department, who's taken it upon themselves to kind of share these 1-minute exciting video clips for each of the parks that they want to highlight on their social media page. And the third strategy I'll mention is the one that is really talking about advocating for sustainable funding so that there can be equitable access to safe and affordable physical activity spaces for all residents. That was really focused on a couple of factors. The first one is that there will need to be new partnerships that form, especially after the pandemic. For all of you that may be aware of how city budgets tend to work, parks and recreation budgets tend to get hit really heavily after any major economic downturn. And so recognizing that, looking for innovative ways to partner, especially focusing on issues like health equity, was something that the Parks and Rec sector was very interested in doing. Related to that, and this is going to speak to this Parks and Rec joint effort within the infrastructure sector work group, is an emphasis on getting better sidewalk connectivity to parks. There are programs like Safe Routes to School, but there's also emerging programs like Safe Routes to Parks. And these are funding mechanisms to increase access to physical activity in park spaces. And really the last thing I'll mention, but it was a heavy topic throughout the entirety of the sector work group conversations, was highlighting the disparity in amenities between neighborhood parks that promote highlighting the disparities between neighborhood parks in different areas of Kansas City, so that the Parks and Rec sector can promote more equitable investment strategies. That kind of speaks to how sometimes larger regional parks can soak up a lot of the funding from Parks and Recreation departments, but finding access to physical activity in your neighborhood might mean that more emphasis needs to be placed on local neighborhood parks. I'll just end by sharing that because of the work of Jen and Roosevelt and Laura and Maggie, a lot of these conversations start to overlap because we're talking about changes to the built environment to promote physical activity. So to that end, the earlier, late last month, a couple weeks ago, we hosted our first ever joint physical activity in parks and infrastructures working group meeting, sort of like Healthy Schools and Early Childhood were sectors that came from working group meetings. Weighing In is now convening a dedicated working group specific to this idea of promoting physical activity in parks and infrastructure. And we're going to have our next meeting on the 31st. And if you sign up for our newsletter, you'll see the first invite that goes out for it. But look for that on the new newsletter page. There will be a physical activity in parks and infrastructure newsletter, but we'll also promote it on our KCPA plan website so anybody can attend if they're interested. The format for these meetings is a little different. What we're going to be working with is making space for other sectors to join. So we're already talking right now about having a meeting with Healthy Schools partners in the sector work group. So Emily and Laura and Jen have been talking about ways to pull that off, but we're excited to have that meeting hopefully in the near future. We'll share more about it when it gets scheduled. But in between those quarterly meetings that we're hosting these cross-sector conversations, we're going to be having also dedicated presentations on specific projects that are coming out of these strategies. And so our first one on March 31st, we'll be focusing on 3 projects related to health equity in parks and recreation spaces, infrastructure as well. And that includes 2 of the grant funded projects that Weighing In has supported through the KCPA plan, as well as a larger initiative from the KCMO Parks and Rec called the Quality of Life Improvement District. So we're really excited to kind of have these opportunities to lift up, support, and connect the types of work that is moving the KCPA plan from a plan into implementation. And I'll leave it there and send it back to Shelley.
Great update, Matt. I do want to highlight a couple of things for this sector. So while you heard Matt talk about Roosevelt and Jen, who are both from the City of Kansas City Department of Parks and Recreation, we do have involvement in that group from other park and recreation departments across the region. So as a reminder, Our regional plan is focused on 6 counties, 4 in Missouri, 2 in Kansas. And specifically in the park and recreation sector, we have had participation, and I want to recognize the participation from Johnson County, Wyandotte County, and both Clay and Platte. So we invite others to join the efforts as well. We know that there are both county and city parks and recreation organizations. I will also mention interest from the Kansas Recreation and Park Association, which is sort of that overarching statewide organization that's sort of following what we're doing and looking to see how they can use these sorts of strategies or framework to create strategies across the state versus just in our region. So I want to recognize that broad sector approach there. So the last 2 sectors I'm going to go ahead and give an update for, and I'm just going to apologize ahead of time because my sector updates are not going to be nearly as in depth as the leads might give for each of these different settings. So they were not able to join us this morning, but I do want to recognize in faith-based settings, both Reverend Eric Williams from the Calvary Community Outreach Network and Carol Bo Thompson from UMKC Health Equity Institute. They were the co-leads for faith-based settings. They have been working in the area of health and faith-based settings for a number of years now, and we were very excited when they agreed to take the lead for this sector work group. That group began meeting at the summit that you heard Robin mention. So our first real working group meeting, or I guess sector work group meeting, was held at that summit, where we introduced the strategies from the National Physical Activity Plan for the group to take a look at and react to give some thought on what does that mean on a local level. How do those strategies fit to what's currently going on in Kansas City? How does it make sense? And how does it align with other efforts that are currently going on? So they created a survey, sent it out to a broad group of individuals working in faith-based settings. We were able to get feedback from that, and through those efforts, reduce the strategies from 6 to 5. Yes, we're a very ambitious group. The strategies, as you can see, are really looking at faith-based organizations using their health ministries to promote physical activities. At the Calvary Community Outreach Network, they have created a wellness center and are very interested in promoting physical activity. Part of the conversation has been around, it doesn't always, well, first of all, physical activity isn't the first thing you think about when you think of faith-based settings. But it is a very important opportunity and a very important sector for people to begin thinking about that. And how do we think about it from a congregation standpoint as well as an employee standpoint? One of the things we've noticed in our sector work group is we would love to get more diversity in terms of religious denominations, health ministries, that sort of thing to inform the efforts of this group. Because the way different denominations set up, as we found out, is a little bit different. How do we encourage physical activity being part of the norm when it's not a normal part of church services? So the next strategy is really looking at cross-sector partnerships to promote and deliver physical activity programs. So again, a common theme that you've heard through all the sector updates this morning. Looking at long-term plans that include promoting physical activity for not just congregations, but many of these churches that are participating in our work have effective ministries within their community. And how do churches impact physical activity both within the congregation, the employees of the church, and then also within the communities that they serve? And that cross-sector partnership is really important because, as you've heard mentioned already, safe routes to parks and infrastructure can be really important in terms of physical activity, getting people to church, getting them physically active in and around the communities in which they live. The other parts that they're very interested in is marketing And when they say marketing, really thinking about how do we help everyone understand the importance of physical activity, why it's important, how it improves health, its relationship to chronic disease, and that relation to faith. And partnering with public health organizations to house an electronic resource where we can learn a little bit more about what's going on, what's the evidence around physical activity in faith-based settings, and how this connects to other pieces. I will say that in the faith-based sector, there have been a number of challenges, as we've sort of mentioned over the past year. The priority in faith-based settings right now really remains getting back to in-person church services. And so moving forward with programs or pilot projects, as you've heard mentioned in some of the other sectors, really isn't realistic at this time. But I do want to recognize this sector for the amount of effort that they put into creating the strategies and priorities when they've had these competing issues going on. There was another thing I was going to mention with that, and now it just sort of slipped my mind. So with that, I will just recognize Carol and Reverend Eric Williams for all of their efforts to keep this moving forward. I remember what it was. It's bringing physical activity into work that's already going on in faith-based settings. And so that group has heard mental health as a real challenge in faith-based settings, and how do we help others understand the value or the benefit of physical activity to mental health as well. So we are hoping to align with some of the initiatives going on in faith-based settings to improve mental health, et cetera. Okay, so enough of that. I'm going to move on to the healthcare sector and give a short update on that as well. I want to recognize Dr. Jody Dickmeyer, who is a pediatrician in general pediatrics at Children's Mercy and is the sector lead for this group. She's not able to join us this morning because she's seeing patients. And again, her ability to give the sector update far exceeds mine, but I have been supporting that group, so we'll do my best to give a general update on the work of this group. This group also started meeting at the summit and has been meeting about monthly since that time. The group continues to meet monthly, and that group has a diverse group of professionals who have been participating. And one of the hopes as we move forward is that we are able to engage providers across the lifespan. We have quite a few pediatricians who are participating. We have a couple of adult providers, and we're really hoping that as we get this work started, we can engage others in that space to join our work. Strategies in this sector include partnering with other sectors to promote access to evidence-based physical activity related services to reduce health disparities. They're also looking at increasing the priority of physical activity assessment, advice, and promotion, so that when you go to your primary care provider, or quite honestly, any provider, they're bringing up the conversation about physical activity and physical inactivity, why that is important, and how we begin that conversation to change that within the healthcare setting. They've also identified recognizing physical inactivity and insufficient physical activity as treatable and preventable conditions, and including basic physical activity education and training with all healthcare professionals. So what this group is working on at this time, a couple of really exciting opportunities have come to light recently that we're hoping to gain some momentum on. We have partners at UMKC in their School of Medicine. There is some interest, including lifestyle curriculum, into education for health professionals, specifically looking primarily at medical students, and then also including some of this in fellowship programs. We'd really love to see physical activity as part of the education in all health professionals. That would include, you know, any of the allied health professionals. So for example, as a registered dietitian nutritionist, it would be included in training for registered dietitians. We hope that it could be included in pharmacy education, public health, nursing, etc. So testing some of this in a couple of those areas is a really exciting opportunity for us. Another thing that has come up at Children's Mercy, we do include a physical activity assessment question in well child checks. We have interest in aligning that with the exercise is medicine movement, where there are some validated questions that can be asked with adults in primary care settings to bring to talk about physical activity and its importance in terms of chronic disease prevention and treatment. There is additional interest in the primary care setting for children to focus on physical activity and having that conversation in well child checks, and some interest in identifying, or maybe not identifying may not be the right word, but testing PARC prescriptions. So this would be a really fantastic cross-sector opportunity for healthcare providers to provide prescriptions for physical activity in PARC settings in and around the Kansas City area. So we're really excited about a grant opportunity related to that, to see what might work in this setting. So those are sort of the areas that we have the most momentum at this time. We're really excited to begin testing some of those and invite others to join us in that work. So with that, what I would like to do right now is just take a minute to open the conversation up to anyone who's here to ask questions about what you've heard, what might be going on in the sectors, and or share information about work that you know that's going on that aligns with what we've shared this morning. So feel free to unmute yourself. If you would prefer to type a question in the chat, feel free to type something in the chat. We'll be monitoring that. As you're thinking about those questions, I'm going to go ahead and just remind the group that you can join any of the sector work groups. You can do that by going onto our website. You can do that through the evaluation. I'm going to ask Emily to post that evaluation link in the chat so you can see. You can have quick and easy access to that. I'm also going to open it up to the rest of our weighing in team to see if there's anything else that they would like to share related to efforts currently going on. I'm going to take silence as we are so thorough in our descriptions that you have no questions, because it's clearly explained and inspiring.
Shelley, I can share. I was going to say, Shelley, I can share one little minor update, because I think it's helpful for this group to kind of hear how these types of implementation efforts might move forward. And I see questions popping up in the chat. I can't see the chat, but maybe somebody can read those after I'm done. But one example that came out of a recent physical activity in parks and infrastructure sector work group, the group that's meeting, was we had a conversation recently about what does that group want to discuss next as it relates to implementing the strategies and the priorities of the KCPA plan. And the conversation has started to occur with folks at the Mid-America Regional Council about are there criteria for physical activity promotion in how funding gets awarded for surface transportation projects? And so these are very early conversations, but it turned out that there is not a specific criteria for physical activity promotion. And so now we're looking forward to getting a conversation together with that sector work group and with the leaders in those relevant organizations to talk about how can we look at policies or programs that might also encourage physical activity. Just asking the question about these strategies brought up a whole new opportunity to start to make changes as it relates to how we approach promoting physical activity. So I just want to lift that up as just one example that's only come up in the last month or so, and we're excited to see where those conversations lead. So of course, if you want to be a part of that, please consider joining the relevant sector work groups.
Thanks, Matt. Anything else? Anyone else would like to share? So as we sort of wrap up this section around the physical activity plan, I really want to sort of bring back the highlights that you've heard mentioned quite a few times during these sector updates, and that's the amount of work that's been put into, the amount of thought and effort that's been put into each of these different sectors and identifying the strategies and priorities for those sectors. The number of opportunities for cross-sector work. And those will continue to come up. We will continue to reach out to others and connect people together as you begin to identify those things. The importance of aligning our efforts, you're hearing that over and over again, and ongoing conversations. So I really hope that everyone can see themselves somewhere in this work. And if you haven't already joined one of our sector work groups, I do hope that you are able to join one or more, including those that we're going to be starting here in the next few months. So
Shelley, I'll just add just one quick comment that we understand that we've been talking a lot about the Kansas City Physical Activity Plan for the last year or so, but we understand that it may be still quite new to you or your organization. And so it is, it's not uncommon for us to, attend one of your organizations, weekly meetings or something, or staff meetings, and just give you a little overview about what we're doing and how your group might fit into it. So if that's something that's of interest to you, you can just reach out to any one of us within Weighing In, or to the general Weighing In email account. We've done those things in the past, and we're happy to do it again.
Thanks, Robin. Now I'm going to move on into other Weighing In updates. I do want to remind everyone to follow us on social media. We have platforms on Twitter, Instagram, Facebook, YouTube. YouTube is where you can find the videos and the recordings from all of the things that we do. You can also see that we have community conversations with our partners. Those also can be found both on our Fitastic website as well as our YouTube channel. I will invite any of our partners or any of you that are on the call, if you're interested in participating in a partner spotlight with us, please reach out. I want to thank Emily for leading our most recent one. I believe it was with Lisa Farmer, who was talking about this program that just happened last Saturday in the early childhood sector. We are open to sharing this information and helping you get the word out about ongoing efforts you have. So please reach out to us if you're interested in being one of the partner spotlights. I want to invite you to sign up for our newsletters. We have a monthly newsletter that goes out. That's a general newsletter sharing information. And in some cases, we're sharing information from you as our partners. If you have information you'd like us to share in our monthly newsletter, please feel free to let us know that you would like us to include that, and we're happy to include that in our monthly newsletter. You also heard that we have some very directed newsletters that we've been putting out. We have one for healthy schools, we have one for early childhood, and you heard Matt just talk about parks and recreation and infrastructure, a new work group that we're forming. That will have a newsletter that goes out. Those generally go out on a monthly basis also, and are sort of focused in those specific areas. If you have information you would like us to include there, great, we're happy to do that. Otherwise, we invite you to sign up for those newsletters. You can do that through the evaluation. So here's one more plug to complete that evaluation. We will be developing some social media related to the physical activity plan. So for any of you who would like to share your connection with this work, let us know. We invite you to follow our social media. You can share it that way. If you would like to access our social media graphics, please reach out to us and we can help you do that as well. So with that, I'm going to pause for a second and invite any of you on the call to share updates about what's going on in your areas.
I have one, Shelley.
Thanks, Michelle.
So just another kind of a whole bunch of people on this call were involved, but March 20th is International Happiness Day. And Casey Healthy Kids started a new initiative this year called Champions for Happiness. And this year we're doing the Haleo Project, which has been a collaboration with Girls on the Run and Kansas City Public Schools, where students were learning flamenco. So they're getting their physical activity and also creating fans with images that make them happy, and haleo, which are words of encouragement in flamenco for artists. So they're doing haleo for the community and spreading happiness. And the exhibit will be unveiled. We have an artist who's combining all their fans into a beautiful exhibit, and there'll be QR codes where you can see their flamenco dances. Will be exhibited at Children's Mercy, and children in the hospital are going to be able to watch the digital workshops and create their own fans as well to add to the exhibit. But if you want to participate, this is open for the whole community. All of the artists sessions are online, and you can even purchase fans and send them to us, and we'll add it to the exhibit. So I'll put a link there. So to spread happiness, get a little physical activity, be looking out for that on March 20th.
Thanks for sharing that, Michelle. That sounds fantastic. Happiness is something that everyone needs. Anything else that others would like to share? I'm going to lean on the weighing in team to let me know if someone's hand is raised and I don't see it. We'll give it just a few more minutes to provide any other updates. One of the updates I will share is about the community garden. I hope all of you are aware that Children's Mercy has a community garden. We will be opening the garden in April, which is a little bit later than we anticipated, but we are going to be able to put in irrigation this year. So that's going to be a new infrastructure component there. That is going in the beginning of April. We will be planting our garden starts toward the end of April. We will have another full year of garden growth and are really excited for that. I invite you to check out our community garden page on the Children's Mercy website. That is, if you go onto the Children's Mercy website, you'll see a tab at the top called In the Community. Under In the Community, you can find more information about weighing in our efforts here, but you can also find a community garden page if you're interested in either becoming a volunteer in the garden or are interested in how we distribute the produce and connecting to other resources. So just wanted to share an update on that. Okay, did I miss anything? I'm looking at Robin and Matt. Okay, well, with that, thank you, Emily, for including that meeting eval in the chat box. I want to thank you all for joining us this morning. We're going to give you 30 minutes back in your day. I want to highlight that our next meeting is June 10th. That's a Thursday. Go ahead and mark your calendars. We'll be sharing additional updates with that in our monthly newsletters. And I did just see something come through the chat. Kansas City University is allowing community volunteer programming for the med students again. Oh, very exciting. Currently enrolling families for CHAMPS, but are struggling because we did not have any Score 1 screenings over the last year. If anyone knows of any families that would benefit from health coaching from med students, please let Katie Bennett know. If you look at the chat, you can see her email in the chat. So thanks, Katie. Thanks for sharing that information. Champions for Champs has been a program that has connected with Weighing In and used their Fantastic messaging for quite some time. So thanks for that update. Okay. If there's nothing else, thanks again. Great to see all your beautiful faces. Enjoy the rest of your Thursday and have a wonderful weekend.